5 big reasons that teens experience depression. Plenty teens experience depression each year. About 1 out of 9 teens have had a major depressive episode. And those rates continue to rise. Typical depression symptoms include a loss of interest in things that were once pleasurable, extreme sensitivity to things like rejection and failure, sleeping problems and decreased energy levels. When teens are depressed, you may notice their performance in school starting to slip, and their overall motivation decline. Experts don't know exactly what causes depression, but various factors are thought to contribute to the disorder. Psychology experts find the most common signs of depression, and the reasons that may be behind the mental health condition spike. Number 1. Self-esteem issues. A lot of the teen depression cases are related to low self-esteem. Teens who experience bullying, academic problems, body issues like obesity, or even those who are questioning their sexuality, or identify as lesbian, gay, bisexual, transgender, LGBT, are at higher risk for depression. In fact, one study found that adolescents with low self-esteem between the ages of 12 and 16 were at a higher risk for developing depression. Why? Some researchers think having low self-esteem as a teen makes for less emotionally resilient adults. Number 2. Health conditions. People who live with long-term diseases like asthma or chronic pain syndromes are at increased risk of depression. Bipolar disorders, personality disorders, and anxiety disorders can all coexist with depression too, if they have a physical disability that sets them apart from other kids their age. That would be a risk factor. Number 3. Genetics and family problems. If someone in your family has a history of depression or mental illness, your child may be more at risk for inheriting the disease. Studies show that while it's not always the case, depression can be hereditary. Teens who experience even normal stressful life events, such as divorce, death in the family, dysfunctional family dynamics, or exposure to a family member with suicidal thoughts also have an increased risk of depression. Number 4. Social media and unrealistic expectations. Another possible reason for depression in teens is the increasing popularity of social media. When using social media, they are faced with unrealistic expectations of how they should be and who they should be. Looking at actors, bloggers, and other teens every day can cause teens to put more pressure on themselves. Experts explains the term Facebook depression as the depression that teens may feel after spending large amounts of time on social networking sites, only to feel unaccepted by their online peers. Most teens log on to social media sites like Facebook, Twitter, and Instagram more than once per day. Number 5. Lack of sleep. We're all grumpy if we don't get enough sleep. But when teens skimp on sleep, they have bigger issues than just a little bit of moodiness. Experts recommend teens get 8 to 10 hours of sleep every night. One study shows teens who go to sleep after midnight are 24% more likely to experience depression than teens who go to bed at 10 p.m. or earlier. Depression and sleep dysfunction often go hand in hand, as depression can also cause insomnia or other sleep disorders. And while researchers still aren't clear as to why poor sleeping habits may lead to depression, a tired teen may have impaired judgment and may have a hard time dealing with regular daily stress. If your teen is experiencing depression symptoms that interfere with their everyday lives, the first thing you should do is talk to your doctor or a mental health physician.